Applied Behavior Analysis, ABA, is a scientifically driven method of teaching skills and reducing problem behavior. ABA focuses on understanding and applying the basic universal laws of behavior. These laws apply no matter who you are and are as reliable as the law of gravity. ABA is highly individualized with motivation at its core. It seeks to understand why behavior continues and identifies the root cause of behavior. Although commonly associated with children with autism, the principles of ABA apply to everyone. Early on in the field, ABA was used to help individuals with autism appear normal. And while there are still some therapists who target stereotypies, eye contact, and other autistic traits, these behaviors are critical to the well-being of the individual and should not be targeted for change unless they are harmful, such as self-injurious behaviors, or significantly interfere with their daily activities. Learning ABA will help you understand behavior in a new way. With this knowledge comes a responsibility to use it in the best interests of the individual. Can you use ABA to manipulate your spouse into doing the dishes every night? Yes. Should you? Well, maybe, but you should not use these strategies to teach your child to do things that are of no benefit to him. Finally, if you haven't heard someone refer to ABA as abuse yet, it's important for you to know that this is common. Many adults with autism are speaking out against ABA. It's important that we all listen and respond to their concerns. Many have valid points and can help guide us in using ABA in a way that respects the individual. We aren't trying to change who they are. When used ethically, ABA is the most effective way to teach individuals with autism the important life skills they need to learn. ABA is the science of behavior. And while the science applies to all behaviors, let's get clear on the behaviors we'll focus on with the training. Behavior is anything that a person does. It may be overt, that is observable to others, or covert, that is not observable by others. Going from a standing position to sitting in a chair is an overt behavior. Others can see it happen. Thinking about what to make for dinner is a covert behavior because others can't see it occur. Typically, the goals of ABA target overt behavior. ABA can be used to reduce challenging behaviors such as yelling or screaming at inappropriate times, hitting and aggressive behaviors, tantrums, and jumping on furniture. But ABA is also used to teach new skills. In fact, the challenging behaviors listed earlier can often be reduced by teaching functional communication. Other skills taught might include play skills, social skills, and academics. Applying these principles does not control the behavior of others. By controlling the conditions surrounding behavior, you make behavior more or less likely to occur. In other words, changing your behavior changes the behavior of others. It's best not to identify a behavior as either good or bad, but rather consider the context within which it occurs. A desirable behavior is appropriate to the context of a given situation. An undesirable behavior does not fit the context of the situation. Look at jumping as an example. Jumping on a trampoline is in context. It's good exercise, it expends excess energy, and it may be a social experience. Jumping on a chair in the living room is out of context and may be problematic. For the purposes of this training, when we talk about reducing behaviors, we will be focusing on reducing behaviors that are out of context. So how can we use ABA to reduce behavior that is out of context? By understanding the motivation behind it. Just about all behavior continues because the person either gets something good or avoids something bad. In order to effectively change a behavior, it's critical to learn more about why the behavior is occurring. Before determining how best to respond to a specific behavior, you need more information. You need to know the function of the behavior. That is, you ask the question, why is it continuing, to determine the appropriate intervention. What they get from the behavior may not be obvious, but together we will learn what motivates your child and help him learn better.